Hello, everybody. Thank you so much for joining us on this beautiful Tuesday. At least I hope it's beautiful for you guys. Thankfully, I am broadcasting live from my office and not my weekly spot, at least for the last month of broadcasting from my closet during a torrential storm and tornado. So hopefully we will have I know we will. It's a beautiful day. It's a tornado siren and rain-free webinar Tuesday. And hopefully we'll keep that up for the next couple of months. I am super excited about today's presenter, my dear friend, Dr. Marty Kotlar. He is no stranger to this webinar series or the chiropractic program. Many of you, I am sure, have had the great pleasure of attending one of his classes live and in person. And if you have not done so, let me just tell you, he is absolutely dynamic in a webinar. It's an incredible experience to be able to meet him and hear him speak live and in person. And I hope you'll visit the Target Coding website where you can see his upcoming dates for live events and have that incredible opportunity. He is the founder of Target Coding, which was designed to assist healthcare professionals accurately and adequately manage their health insurance reimbursement activities. He is certified in CPT coding and healthcare compliance and a member of the American Chiropractic Association, International Chiropractors Association, American Academy of Professional Coders, American Medical Billing Association, American Association of Medical Audit Specialists, and the Council on Chiropractic, Physiological, Therapeutic, and Rehabilitation. He's one of my go-to experts and the person I lean on, probably more than he would prefer, when I have billing and coding questions for sure. Really just questions about everything practice related. He's definitely one of those people that I lean on and have for over a decade. And I am beyond grateful for our personal and professional relationships. So Dr. Kotlar, thank you so much for being here today.
Thank you, Christy. Just want to make sure you can hear me okay.
Yes, sir, we can.
Okay, very good. Thank you for that introduction. I appreciate you inviting me to do these webinars. I definitely enjoy doing them. I hope everyone else enjoys them also. So today's topic that we're going to be going over is how to get paid for back braces, home traction, and how to become an authorized Medicare DME supplier. Just to let you know, just a little disclaimer, this information is for educational purposes. It's not intended to substitute your thorough clinical decision making. It's not intended to substitute your billing protocols. It's not intended to be legal advice. Target Coding doesn't provide legal services. And yes, I consider myself kind of unique because most chiropractors are not certified coders. Most certified coders are not chiropractors. So you'll see during this presentation how I combine both specialties to make sure you're doing things right and you're complying with all laws and rules and you get reimbursed what you deserve. So DME, durable medical equipment. Just to start this presentation, this is not for everyone. I would say only about 30% of the doctors we work with incorporate DME. So DME is something that you may want to add if you want to add an additional profit center, if you're stale in your collections and you're looking to add additional income, you're looking to do something different, you may want to check it out. Those of you that are doing it already, you know it could be a very advantageous service for patients. That's always number one. It's got to be good for the patient. And number two, DME could be very, very profitable. There are some back braces that may cost you $100, and you may be able to get paid $500, $600, $700. So it could be very profitable. So DME, it's known as items that can stand repeated use. It has to be helpful for the patient. It helps them with activities of daily living. Again, just to make sure, hello, Kissy, could you hear me okay? I don't know if somebody's saying some sort of sound connection issue, but you can hear and see the screen okay?
I can.
Okay, very good. So, yeah, just to make sure, contact your state board. I'm pretty sure every state in the country allows chiropractors to dispense DME. Doesn't mean you'll get paid for it by an insurance company, but you should be able to provide patients with back braces. It could be an overall excellent approach to patient care. And it's just like I said, maybe you want to add maybe laser or decompression, vibration therapy. It's just another service that you could add. Not only chiropractors find back and knee braces and home traction and general DME to be important and profitable, but many medical offices and physical therapists also provide back and knee braces. You just want to be able to feel comfortable with it. For example, you can provide during the corona pandemic, the public health emergency, some of the clients we work with were having patients, they were being sent a back brace to their home, and through telehealth, through a webcam, the patient was instructed on how to use the back brace. Why? Because the patient didn't want to go to the emergency room and didn't want to leave their house because of the coronavirus. So telehealth became very popular. But I told doctors, don't start dispensing and charging patients for back braces via telehealth if you've never done it in person. Get familiar with it with patients that are coming into your office first. You need to feel comfortable explaining durable medical equipment to patients and insurance companies if you're getting paid for them, and possibly to attorneys or malpractice carriers or state boards. So you may see the term DME, POS, DEMIPOS, that's the formal term for durable medical equipment, prosthetics, orthotics, and supplies. When you hear DME, some of you may be thinking, oh, wheelchairs and walkers and scooters and diabetic supplies. Well, we don't specialize that, at Target Coding. We don't help doctors. We get calls all the time. Just about every week I get contacted from a company that wants Target Coding to assist this company with diabetic supplies and oxygen equipment. We don't do that. We specialize in back and knee braces mostly. So you see the ones that we work with: back, knee, home traction, canes, crutches. Who pays for DME? Everyone. Medicare Part B, Medicare Advantage plans, commercial plans, cash patients. Now, that doesn't mean they're going to pay you. For example, if you're seeing a Medicare Part B patient, Medicare doesn't pay chiropractors for DME unless you become a DME supplier. But they do pay for it. Everyone pays for it. Depends if they pay chiropractors. We're going to go into that in a few minutes in detail. But I tell my clients that are referring patients out for back and knee braces, have you thought about doing it in-house? You might be better off managing the case in-house instead of referring out. Okay, let's just go through quickly. A new patient comes in leading up to DME. Make sure the patients are filling out all the proper forms, just general recommendations. Here's a sample intake form, HIPAA forms. There's something called the new no surprise law. A good faith estimate is required now, especially if you're out of network. It's actually required. If you're out of network or you're seeing a patient that's self-pay uninsured, the no surprise law and good faith estimate form is now required. So get all the forms out of the way. The good faith estimate form must be displayed and available for patients to see and review. The no surprise law was all about patients being taken to hospitals, and they didn't realize that if the patient, let's say, was going under surgery, they had to go under anesthesia. The hospital, now the patient knows the hospital's a network, but the hospital employs or brings in an outside, out-of-network anesthesiology group to do the anesthesia. And then a few months later, the patient unknowingly receives a bill from the anesthesiology group for $3,000. Surprise! Well, that's illegal now. Can't do that anymore. So this no surprise law, it's been in all the headlines of all the major newspapers and television shows, news shows. January 1st, just a few months ago, the no surprise law became effective. So this does pertain to chiropractors. So this no surprise law is for patients that are self-pay out-of-network, uninsured, or patients that have insurance but they don't want to use it. Or they have insurance but it doesn't cover services like DME as an example. So you have to let the patients know how much it is going to cost before the services are provided. Now remember, your in-network patients, Medicare patients, PI patients, it doesn't pertain to those patients. It's not meant for those patients. It's not required for those patients because you're just going to follow the normal copay, deductible, coinsurance rules. It's for out-of-network patients, self-pay patients. They must be told in advance. It has to be within $400. You need to tell the patients how much it's going to cost within $400. And the federal government gives out this sample surprise billing protection form. I don't know how many of you have seen it, but it's really complicated. It's not simple the way it's outlined to give to patients. So what we've done is we've put together a simplified no surprise billing form. If anybody would like a copy of it, just send an email to amy@targetcoding.com, amy@targetcoding.com, if you'd like to see our sample good faith estimate form regarding the no surprise law. We kind of simplified it and made it easy to, you have to put the information in the waiting room, or if you have a TV that has scrolling information. So that is provided in what Amy will send you, what you have to notify the patients of, and then the actual good faith estimate form will be in the sample if you need it. Send an email to amy@targetcoding.com. So supplying patients with DME starts with medical necessity. It starts with a thorough treatment plan. Make sure you are putting together a DME treatment plan. In our opinion, it consists of these 5 items: history, exam, diagnosis, goals, and then your specific DME recommendation. I look at this like the foundation of a house. Now, you should be putting treatment plans together, whether it's DME or just for chiropractic. It's like the foundation of a house. You want to build a good foundation, and then you can build everything upon it. If you don't have a good foundation, everything starts to crumble. So history, of course, basic history, chief complaint. Mrs. Jones is complaining of lower back pain. HPI, it started about a year ago after lifting a heavy laundry basket or doing excessive yard work or from playing soccer. It's sharp and dull at times. The pain scale is a 7. It does radiate down the leg. The patient has had x-rays. It shows disc degeneration. The patient has also had an MRI, and it shows spondylolisthesis and herniated disc, all that stuff. Review of systems, past family social history. So, Mrs. Jones, have you ever had any trauma to your spine? Ever? Do you have stress? Do you exercise, smoke cigarettes? And then a good quality exam, basic palpatory tenderness, range of motion, check posture, orthopedic, neurological tests. We've expanded here. We'd like to show our clients expanded muscles that are involved. If you're going to be supplying a patient with a lumbar brace, check these muscles. This is where I mentioned at the beginning of the webinar, being a chiropractor and an expert certified coder, I combine the two. I give you clinical stuff, and then I show you how to bill for it. We have clients that, they're using radiculopathy and other codes, and I review their notes and I go, whoa, doc, you can't use that code. You don't have the breadcrumb trail leading up to it. Knee exam. About 25% of the doctors we work with now are chiropractors that have brought in nurse practitioners. That has become very popular over the last 5-6 years. So we have a whole nurse practitioner program on knee injections. So we like to show the nurse practitioners the specific muscles. So just a reminder, these guidelines changed. The exam and re-exam guidelines changed on January 1st of last year. So about a year and 4 months ago now. Remember, they're based on either time or decision making. Time includes documenting the notes, reviewing records, things that were never allowed in the past. So these are excellent new guidelines. It's helping a lot of doctors make a lot more money, and that's what they were intended to do. Specifically, it was part of an initiative put out by the federal government pre-COVID back in 2018. It was called Patients Over Paperwork, and it was designed to allow doctors to spend more time with patients, specifically for these guidelines, and be able to have a less administrative burden. So, time or decision making. You can use decision making. Get familiar with the three elements, which are number one, the amount of problems, number two, the data to review, and number three, the risk level. And then if you want to spend, let's say 30 minutes for a 99203 based on time, that's great. 30 to 44 minutes. But if you want to use decision making, you can possibly do that in maybe 20 minutes. See, that's how you could make more money. Just make sure to get familiar with the decision making guidelines. And if you don't have time written in your exam or re-exam notes, then it just defaults to decision making anyway. And, when I never do my live, Christy and I were just talking before the webinar, like, when are we going to start doing live seminars? Everybody's been kind of shut down because of COVID. So live seminars, yeah. Christy said she's going to be at a ton. I'm starting to do a bunch of live. Finally, we're coming out of the COVID cave. Whenever I do my live seminars on the breaks, a lot of CAs will come up to me and some doctors and say, hey, how do you become a certified professional coder? How do you become a certified billing and coding specialist? Christy probably gets the same questions when she does her live events. And I just like to show these are the books that you need to read. These are the items you need to become familiar with. You need to study these books. These are the things I read all the time, even now. And I use these as, my library. Always reading the Medicare Benefit Policy Manual and the Medicare Claims Processing Manual. All the individual insurance company guidelines on chiropractic and DME and TENS and laser and decompression from Aetna and Cigna and ASH and Optum and all the managed care organizations, Centene, Ambetter. There's so many of them out there. You need to stay up to date on these things. I probably spend, $8,000 to $10,000 a year on coding books, seminars, webinars, knowledge-based lists, AMA subscriptions, consultants, coaches, advisors. Yes, me, I'm the expert, right? In coding and compliance. I have a coach. LeBron James, best basketball player in the world, right? He has a coach. Tom Brady, greatest of all time football player. Yeah, he has a coach too. So just wanted to share with you some of the items that I'm always reading and staying up on. Next, as far as DME, diagnosis codes, you could use pain and symptom codes. Very nice. However, you want to use more codes that are condition-based. Much better than just pain codes like radiculopathy, cervical radiculopathy, lumbar radiculopathy, sciatica. Look at that, M54.3. That's sciatica. Never use that. M54.30, sciatica unspecified. Please don't use that. The ICD-10 guidelines state you must choose the diagnosis codes to the highest degree of specificity. Is it on the right side or left side? Now in ICD-10, we also have a combo code. Back in, I still remember all the ICD-9 codes. ICD-9, we had low back pain, 724.2, and sciatica, 724.3. You had to record both if that's what the patient had. Well, in ICD-10, we have a combo, low back pain with sciatica, M54.4. Don't use that. M50.40, don't use that. It's either right side or left side. Now, some of you may be saying, Dr. Kotlar, what about bilateral sciatica? Yeah, if I was on the ICD-10 coding committee under the World Health Organization, that's who governs and maintains ICD-10, is the WHO, World Health Organization. If I was on the committee, yeah, I would have an M54 let's say 33 for bilateral sciatica. It doesn't exist at the present time. You always want to code to the highest degree of specificity, and this is some Clinical information. Here, I'm going to get clinical with you. If a patient comes in with sciatica, I strongly recommend you do some orthopedic neurological testing, basic straight leg raise. I was just reviewing a doctor's notes. The note said, Mrs. Jones is complaining of sciatica down the right leg. And now I'm looking at the doctor's notes. And her exam, the doctor's exam says, left side straight leg raise normal. That was it. This is a patient complaining of right side leg pain, sciatic pain. The doctor used sciatic on the right side as a diagnosis. Examination says left side straight leg raise normal. That was it. She didn't do straight leg raise on the right. And if you're going to do straight leg raise, put the amount of degrees. Again, I'm getting clinical here. Patient should say, your note should say, patient has pain, numbness, tingling down the leg, Vectoroo, Braggart, slum test, diminished sensation, palpatory tenderness, antalgic lean. These are the items that will help justify, and it's this little breadcrumb trail that I always talk about leading up to the proper diagnosis. And it also should pair, like diagnosis codes should pair with your procedure codes. I call it CPT ICD-10 code pairing, just like food and wine. Yeah, here, I have an example. CPT code traction pairs beautifully with M5412 and disc degeneration, just like food and wine. It's actually a book. I wrote a book many years ago on how to pair your codes. Oh, here it is, how to pair your codes. So you may be interested in it. The first section is about pairing your codes. The second section is on showing you the codes that pay the most visits. I call them long-term treatment diagnosis codes versus the short-term. They're also in there. Plus you get a whole bunch of cheat sheets. Oh, and then there's 3 chapters. Chapter 3 is the clinical chapter. It gives you the orthopedic, neurological, chiro tests for 25 of the most common diagnosis codes in chiropractic, like sciatica. Disc disorder, disc displacement, make sure you know the difference. Myelopathy, that's a term that's important to know. Myelopathy, that's spinal cord compression. So if you're going to diagnose a patient lumbar disc displacement with myelopathy, you definitely need an MRI. I get that question a lot too at our help desk. Dr. Kotlar, do we need x-rays or MRIs to diagnose radiculopathy, myelopathy, disc degeneration? Get those questions all the time. Osteoarthritis, yes, knee braces, very common when patients get a knee injection. Here's the osteoarthritis. ICD-10 codes, stiffness, instability. One of the most important ICD-10 codes, diagnosis codes regarding back braces. For example, many insurance companies in their policy on back braces, DME, it says it is medically necessary if a patient has instability of the spine. Oh, so you're going to provide a back brace, which is going to allow for stability. It provides stability. And what's your diagnosis? Look at that. Spinal instability, M53.2X6. How many of you use that one? It's an excellent diagnosis. Just make sure you know how the instability could be put, that label could be put on a patient. It's not something that's just placed on a patient because here comes Mr. Taylor. He has lower back pain for 3 days. Okay, spinal instability, M53.2X6. No, that would be incorrect. You need to have the clinical breadcrumb trail leading up to using spinal instability. And then, yeah, I mentioned the goals in the treatment plan. It was history, exam, diagnosis. Now we have the goals. The goals need to be improved as the patient, updated as the patient is improving. We strongly recommend using outcome assessment tools. So many good ones here. Oswestry, Roland Morris, they have them for the back and the neck and the shoulders and headaches. It's a great way to monitor progress. Okay, now let's dig in now and talk about lumbar braces and LSOs. Now, you may hear the term orthotic. For many years, I thought orthotics was just foot levelers, foot orthotics, foot inserts. That's what orthotics are. Well, no. Orthotics could be spinal orthotics, shoulder orthotics. Here we have LO, lumbar orthotic, LSO, lumbosacral orthotic. Look at that. Spinal orthotics, the third bullet down. Spinal orthotics are used to immobilize the spine. Spinal orthotics reduce pain by restricting mobility. Should have an intimate fit. The documentation must relate to the patient's functional goals. Have detailed documentation in your records that justifies the code that's being selected. Example, the fabrication methods, the appropriate level of fitting. Yeah, it leads me to these two categories of back braces, off the shelf and custom fit. Big difference. Off the shelf, they're prefabricated, but it requires minimal self-adjustment. Custom fit, they're also prefabricated, but requires substantial modification, expertise of a qualified practitioner, and substantial modification at the time of the delivery classifies as a custom fit. There's a lot of information on the difference between off the shelf and custom fit. I'm not going to get into too many details. Please feel free to send in your questions if you have questions regarding off the shelf back braces versus custom fit. Let me show you a few examples here. L0625. This is a lumbar orthotic. That's it. Just a lumbar orthotic. It provides lumbar support, very simple back brace from L1 to L5. If I had to take a guess, in your area, this pays about $7,500. It costs you, the doctor, probably about $25. I'm just giving you general ranges. Off the shelf, very simple back brace. Again, cost you maybe $25. Insurance, if it pays chiropractors for back braces, you're looking at maybe $75, $100. Then we have LO627. It's also a lumbar orthotic, but this is a custom fit. Look at this. It also provides sagittal control. It also has rigid anterior and posterior panels. They're both lumbar orthotics. One's off the shelf, one's custom fit. Become skilled in DME or employ someone that knows how to measure patients for DME. You may want to consider becoming a certified orthotic fitter. I just became a certified orthotic fitter. I went through the course and I got my certification in it. L0631. Oh, now we have a lumbosacral orthotic. Sagittal control, rigid and anterior posterior panels. Look at this brace. This goes from T9 all the way down to the sacrococcygeal junction. So don't get tricked. There are some manufacturers, they'll sell you a LO625, but they're telling you to bill LO631. If you get audited, boy, you'll have problems. I'll tell you how you could make sure you're billing the right code in a minute. And then we have LO648. That's an off-the-shelf LSO. Let's say you have a Blue Cross Blue Shield patient come in and you want to see if they cover spinal orthotics. Call to verify and also get their policy. This is Blue Cross Blue Shield, Anthem Blue Cross Blue Shield's policy on spinal orthotics. Great information. This is a Medicare's policy on back braces. We have knee braces here. These are some of the most common knee orthotics. You see, it says KO, knee orthosis. These are the policies from insurance companies regarding knee braces. Cigna, yes, covers it. However, will they cover it if you provide it? Here's a sample. If anybody would like a sample osteoarthritis knee brace soap note, here it is. This is a sample soap note for a patient that came in with knee osteoarthritis. It says patient was referred by Dr. Wilson, MD, for a left side OA knee brace. This condition started 10 years ago after injuring her knee playing tennis. Since then, she's had 4 to 5 episodes per year. She has had cortisone injections. They do help. The knee pain episodes last longer lately. The patient presently rates the knee pain 7 out of 10. Due to this condition, the patient has difficulty doing simple tasks, lifting a bag of groceries out of the trunk of her car. That was the S portion. O, alert and oriented. The joint, the knee joint, it was clicking and popping with left knee flexion and extension. The left quadriceps and hamstrings revealed mild weakness. Visual assessment of the left knee reviews genu valgum. Remember that from chiropractic school? Genu valgum. The right side lower extremity did not reveal any abnormal findings. It's good to look at the normal side to compare. And we have a picture here. This is a photo of the knee brace. Again, become skilled in DME or employ someone that knows how to measure patients for DME. This is how you confirm that the belt brace that you're buying has the proper HCPCS code. HCPCS code like L0631, there are codes that begin with a letter. Noridian is the company that's the contractor for the federal government that evaluates and provides proper coding. If a company that, let's say you're buying your back brace from a company, ask them for the PDAC letter. This is what they look like, and it tells you that this company has been approved for the code that they're recommending. PDAC letters, try and get them for every back brace you build. Home traction. This is also something that's covered by most plans. However, is it covered if provided by a chiropractor? Home traction may not be covered if the patient fails a trial of over-the-door traction, or the patient becomes worse with cervical traction, or the patient has some sort of distortion of the neck. E0830, E0849. There are many, many different types of home traction devices. I'm sure you've seen the one with an inflatable air bladder. See that one advertised a lot in chiropractic journals and magazines. There it is, a photo of it in the bottom right corner there. That's E0856. Basic over-the-door traction, rope and pulley type system, E0860. That's probably the most common one I see. Get the policies? Yeah, every insurance company has policies on home traction. Here's a few more. We have some doctors. Hey, Dr. Kotlar, can I sell equipment? For example, we have clients where the patient will be on see the red gym ball, therapy ball, TheraBall. Patient gets 6 to 12 treatments in the office with that ball. And then the patient is told, you've reached maximum improvement. We're not going to be billing your insurance company anymore. You've graduated. You could do these at home. We recommend you buy a ball. We sell them right here in the office, Mrs. Jones. Mr. Taylor, we use these wobble cushions. You can buy them and take them home. Balls, bands, tubes. Exercise equipment, A9300. Any type of pillows, cushions, positioning pillows, wedges, E0190. There's your orthotics. There's a lot of different types of DME out there. This is what you should do. Number one, call the insurance company. If you don't want to call, email. You don't want to email, go online. Somehow, some way, have your billing company contact the insurance company. Find out. Number one, is patient covered for DME? If yes, continue. If no, that's the end of the conversation. If yes, does policy cover DME if ordered and delivered by a doctor of chiropractic? If yes, keep going. If no, cash. End of conversation. Does the policy cover the specific back or knee brace? Yes or no? Did the patient sign your financial policy form? Did you offer the patient the opportunity to get the brace elsewhere for less? If you're out of network, did the patient sign the no surprise law patient rights form and review your good faith estimate? If providing the brace as a self-pay, are you billing the patient the same price as if you were billing the insurance company? Good questions there. Okay, So we're rounding third, heading home. We're just about done with today's presentation. Just want to talk to you about how you, as a chiropractor, can become an authorized Medicare DME supplier. This way you can get paid for back braces and knee braces. Yes, as a chiropractor, you can become an authorized DME Medicare supplier. Just got to do a few things. First step, think about the DME products that you would like to put into your practice. I'm assuming back and knee braces, maybe TENS, maybe home traction, maybe canes, crutches. It's up to you. Check the fees. Go online, check the DME fees in your state. This is one way to do it. Here's the link. Some of you may say, well, how am I going to find out the fees in my state? I don't know what to do. Don't worry. I got it all handled for you right here. This is where you can click on the link and you can find the DME fee schedule for the back and knee braces, for example, for your area. Key points as a chiropractor looking to become an authorized Medicare DME supplier. You need to either employ or become a certified orthotic fitter. Then you'll need to choose one of the 12 approved federal government accrediting organizations. Go through accreditation. You'll need a DME compliance manual, the surety bond. Then you'll complete the Medicare DME enrollment form. It's Form 855S. Receive your DME PTAN, start seeing patients and making money. Now, those of you that have ownership by a medical doctor or a nurse practitioner, you don't have to do any of the items that I just mentioned. Yes, I know it's kind of sad, but if you're a chiropractic or a medical corporation where you have the medical doctor or the nurse practitioner own a minimum of 5% of your corporation, you don't have to do any, you don't have to become a certified orthotic fitter. You don't have to go through accreditation. You don't need a surety bond. You can go right, pass go, straightforward, right to the enrollment form. And then you'll have to choose what type of structure. Is it a PC, PLLC, PA, C Corp, S Corp, Incorporated? How much of the corporation is owned by the medical doctor? By the way, you can do this on your own, of course, or we could help you do it. This is one of the things we do at Target Coding because of demand. We do things because of demand, not because we just feel like it's something people think they want. Just like with HIPAA, when I first started consulting, we didn't have HIPAA compliance programs, but because it became in the spotlight over the past 8-9 years, now we offer HIPAA compliance manuals. We didn't offer billing and coding OIG Medicare compliance manuals because of popular demand from our clients. Now we do it. We never did billing as Target Coding. Now we do billing, so a lot of doctors wanted to become authorized Medicare DME suppliers. So we now have a program. If you don't want to do it on your own, we'll hold your hand through the whole process. We'll show you how to become a certified orthotic fitter. We'll show you what organizations we recommend you use through accreditation. Again, you can do it on your own, just like a regular Medicare PTAN, filling out the Medicare 855 form. You can do that on your own, but many doctors have had Natasha, my assistant. We take doctors and we get them their regular Medicare PTAN number in order to see patients for regular doctor services. So Medicare PTAN, you can do it online. That's what we recommend. Filling out the 855 form right here is the PICOS website. There's also the paper form, which we don't recommend. Again, who pays for DME? Everybody. Part B, Advantage plans, commercial plans, cash patients. There are only 2 companies that pay for DME that cover the entire country. It's either Noridian or CGS, depending upon what state you're in and what jurisdiction you're in. Again, we have this all figured out. Please feel free to ask your questions regarding Medicare, and getting paid for DME. Now, as far as your report of findings goes and talking to patients about money, do a thorough verification. Make sure you have written policies and procedures. It helps educate patients about acute care, chronic care, what's covered, what's not covered. It prevents doctor-patient upsets. Keep fees simple. Remember, if you're going to bill an insurance company $1,500 for a lumbosacral back brace and it's not covered, are you going to charge the patient $1,500? Yes, you're supposed to. Or give them a little bit of a discount. Or if the patient says, I can't afford $1,500, they could only afford $100, then get them a $100 back brace, a different back brace. Patient education is important now more than ever. Check with ChiroHealthUSA on how you'll be able to provide discounts. A couple other things regarding soap. Your soap notes cannot look the same on every patient. Hopefully you know that. I was just reviewing one of my own clients' soap notes. I wanted to do a spot check on him. I said, send me 12 notes, the first 12 visits on a patient. I look at the notes. The first visit looked pretty good. Second visit looked pretty good. The third visit through the 11th visit was exactly the same, verbatim. Visits 3 through 11 were exactly the same. Nothing was different except the date. Not good. That leads to bad documentation. Bad documentation leads to insurance companies sending you letters saying, we want money back. Look at this doctor. Cigna wants $250,978 back because of poor documentation. Doesn't have to be this way. Give them what they want. Read the company guidelines and put that into your note macros. Look at this doctor. They told this doctor, well, this doctor got lucky. They said, we're not going to ask you for money back. Well, we're going to put you on a prepayment audit. So he has to send in his notes with his bills. But they told him why. No signatures, no plan of care. The testing did not change the plan of care. Some patients indicates years of the same treatment without improvement. And they provide the list. Look at this doctor. He's being put on a prepayment audit just for one code, therapeutic exercises 97110. Some of you may never heard of that. Some of you don't use it. Some of you may use it. Well, anyway, this doctor has to send in his notes whenever he bills this code. Why? It says it right in the letter. You did not provide us with the start and stop times. You didn't tell us how the patient tolerated the exercises. So make sure you have good soap notes. Okay, I'm going to now give the presentation back to Christy to see if any questions have come in.
Dr. Kotlar, you have a question. Is DME billed on a 1500?
You know, Christy, you sound kind of muffled. I was not able to hear the question. Hello, Christy. Can you repeat the question?
Can you hear me now?
Yes.
Okay. Is DME billed on a 1500 claim form?
I'll repeat what you said. Is DME billed on 1,500 claim forms? If that's the question, yes, they billed on 1,500 forms.
Yeah. Okay. I don't see any other questions. So if you have a question, please submit that now. And I definitely recommend everybody follow Target Coding Dr. Kotlar on social media. It's where they frequently post updates and information that you need in a timely fashion to help you with your practice. It is such an incredible resource for you and your team. I just want to remind you that next week we have Dr. Cindy Howard talking about headaches and migraines for patients in the practice, how to treat those. And then we'll be talking with Dr. Sharon McAllister the following week about maximizing your ultimate success. We have Dr. Mary A. Bushiri also next month. What are the rules and regulations? What does it really mean to be a cash practice? Dr. Kotlar would agree with me. There is a lot of misinformation about what is a cash practice. And then we will also have chiropractor and best-selling author Dr. Stinsler talking about his book, Dream Wellness, and how to connect chiropractic to the wellness lifestyle. And y'all can check those out on our website. Make sure you register early for those upcoming webinars. Dr. Kotlar, would you like to add anything before we go?
No, I just want to say I appreciate you and thank you for having me. Looking forward to seeing you at an upcoming seminar and future webinars.
I agree. I feel like it's been far too long since we've been able to see each other in person, and I hope that changes very soon. And again, I've also posted an email in the chat log for those of you who are watching live and in the recording. You can reach out to her to get those sample forms that Dr. Kotlar discussed throughout his presentation. If you have any questions, don't hesitate to reach out to Dr. Kotlar and his team at info@targetcoding.com. Thank you, everyone. I hope you have an amazing rest of your day and a fabulous week. We'll see you next week. Bye, y'all.
Bye. Thank you.